I am Dr. Shahnaz Khodaiji, consultant hematopathologist at the PD Hinduja Hospital, Mumbai, India. I have been associated as a consultant with Hinduja Hospital for over 30 years. My role is to oversee every function of the laboratory. Ours is the first hospital-based lab in India to be accredited by the College of American Pathologists. As for my professional affiliations, I am the president of the Indian Society of Hematology and Blood Transfusion. Our lab is a specialized hematology laboratory, therefore testing for hemoglobinopathies and screening for thalassemia are very important. It's one of the most key tests in anemia diagnosis and is a part of our hemolytic anemia profile. Over the years, the results from the Bio-Rad D-10 system have helped our lab reach the correct diagnosis, and hence the right treatment can be given to the patient in the shortest time. So before selecting the D-10 system, we were performing alkaline and acid gel electrophoresis, which were tedious, cumbersome, and had some limitations such as overlapping of common hemoglobin variants that are found in India. When we decided to go in for automation for hemoglobinopathy screening, we considered two options, both from Bio-Rad. One was the Bio-Rad Variant 2 system, which was not suitable for our relatively small workload, and the other the D-10 system, which was apt for our workload. As it was able to pick up almost all hemoglobin variants and thalassemias found in India, we opted for the Bio-Rad D-10 system, which then became an integral part of our lab. We have chosen the D-10 system because of its accuracy and reliability. The need of the hour in a hospital-based lab is prompt initiation of treatment for which a quick diagnosis for the cause of anemia is needed. The total time taken by the D-10 system after running calibrators and controls to running patient samples and getting the result printout is around 6 minutes, which is really quick. It's probably faster than the time taken to get the serum iron studies results. Hence, with the D-10's automation in HPLC, hemoglobinopathy as a cause of anemia can be ruled out almost immediately. We do about 85 tests for hemoglobin A2 and hemoglobin F per month, which is roughly 1,000 tests a year. This number would be larger if we had obstetrics and pediatric specialties in our hospital. The D-10 system also improves lab productivity because of the quick turnaround time, about 6 minutes for thalassemia results and 3 minutes for A1C results. The D-10 can also run small batches of samples economically every day as they come in. There is no need to wait for larger number of samples to come in and run them infrequently. This improves the turnaround time and the overall productivity of our lab. The staff feels that the D-10 system is easy to use because it is fully automated and hence no sample preparation is needed. It requires minimal maintenance and no manual data entry. The kit can be changed easily and quickly. With its touchscreen, user interface, and onboard computer, the D-10 is easy to use. It also easily handles our workload even during a staff shortage crisis. Other features we like include that the system alerts the user to low level of samples as well as when the hemoglobin is low. A quick chromatogram review helps to reveal when the sample is degraded, such as we see high P3 peaks and those with high bilirubin levels high peak at the beginning of the chromatogram, thus giving us an option to get a fresh sample or to run the sample in dilution in order to get the correct result. The hemoglobinopathy chromatogram also helps us to incidentally report patients with high hemoglobin A1C. Furthermore, the QC data can be easily seen and stored, such as in the LJ charts. Up to 10,000 results, more than we need, can be stored, so we do not waste any time in taking backups. We like the quality products from Bio-Rad. Also, the service and after-sales support is good and consistent, which makes us rely on Bio-Rad. The staff is courteous and ever ready to help and sort out our issues. At our lab, we use the D-10 system in 3 patient scenarios. 1. We offer a health checkup premarital package in which a hemoglobin study by HPLC is included. 2. Our lab also offers prenatal screening for pregnant women. 3. All samples which appear to have thalassaemic indices on the CBC are followed up with a hemoglobin A2 and hemoglobin F testing. In hemoglobinopathy testing, the D-10 system can pick up most of the beta and alpha chain variants commonly and rarely found in India. Thus, it gives a comprehensive solution to hemoglobinopathy screening, which helps in improving patient care. Some of the common hemoglobin variants that we have come across since using the D-10 include double heterozygous for sickle and beta thal, hemoglobin D Punjab homozygous, double heterozygous for sickle and hereditary persistence of fetal hemoglobin, and the delta beta thalassemias. We have also detected a case of thalassemia homozygous with very high hemoglobin F. We've also seen peaks suggestive of alpha thal such as hemoglobin H, which eluted before 1 minute, and alpha chain variants such as hemoglobin J, which eluted in P3, and hemoglobin Q India, which elutes at 4.4 minutes retention time. In terms of evaluating results, Bio-Rad offers a great tool in the online library of hemoglobin variants, which helps us to interpret a wide variety of abnormal hemoglobins that can present and help us reach a conclusion by which we can report more confidently. To further support patient care, Bio-Rad as a company has invested in academics and physician awareness by partnering with Thalassemia International Federation, the TIF, and making online educational resources available, such as the TIF certification and Test Your Knowledge, that is the TYK programs. These are great services for clinicians, hematologists, and pathologists. The D-10 system helps in research studies. With the D-10, we have conducted a study on the evaluation of borderline A2 values obtained on HPLC with DNA mutation analysis for beta thalassemia trait. Borderline values of 3.5 to 3.9% hemoglobin A2 pose a diagnostic dilemma because they may have silent mutations. We carried out mutational analysis in these patients to rule out any such silent mutations. We found that the mutations were the IVS intron 5 G2C and the IVS intron 1 G2T. To sum up, I'd like to say that the D-10 is small, it's easy to use. It utilizes gold standard ion exchange HPLC technology that delivers accurate results that I can trust. The D-10 is a workhorse and can handle an increased workload without breakdowns and with quality results. The D-10 system is good for small to medium-sized labs because it can perform hemoglobin A2 and F as well as hemoglobin A1C on a single platform using the same kit.